Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. So today I am going to discuss regarding brainstem. The brainstem is the distal part of the brain that is made up of the midbrain, pons and medulla oblongata. Let me see the functions. To summarize, there are three basic functions of the brainstem: to act as a conduit for the ascending and descending pathways going to and from the brain, to house the cranial nerve nuclei, and to integrate the functions of several vital systems. The motor tract include corticospinal tracts and corticobulbar tracts, and the sensory tract include spinothalamic tract or anterolateral system, dorsal column, medial lemniscus, trigeminal lemniscus, and spinotrigeminal tract, lateral lemniscus. The nerves, the entire brainstem is composed of neural tissue. 10 of the 12 cranial nerves also emerge from the brainstem. Midbrain, the oculomotor nerve, the trochlear nerve, Pons, the trigeminal nerve, the facial nerve or cranial nerve 7, the vestibulocochlear nerve, and medulla oblongata, the glossopharyngeal nerve, the vagus nerve, the accessory nerve, and the hypoglossal nerve. Blood supply of the brainstem. The vertebral artery enters the cranium via the foramen magnum and the cord superiorly along the ventrolateral surface of the medulla. They then unite at the caudal border of the pons to form the midline basilar artery. The vertebral artery gives rise to the posterior inferior cerebellar artery. The later vessels supplies the dorsolateral medulla and the posterior and inferior surface of the cerebellum. The basilar artery gives rise to the paired anterior inferior cerebellar arteries and superior cerebellar arteries. The anterior inferior cerebellar artery supplies the ventrolateral inferior pons and the anterior inferior cerebellum, whereas the superior cerebellar artery supplies the lateral rostral pons and the caudal midbrain and the entire superior surface of the cerebellum. The basilar artery terminates at the pons or midbrain junction by bifurcating into the posterior cerebral arteries. The penetrating branches of the posterior cerebral artery supplies the rostral midbrain and also the caudal diencephalon. The clinical notes of brainstem. Locked-in syndrome. A stroke involving the brainstem is likely to result in complete paralysis of the facial and body muscles. In total locked-in syndrome, the eyes muscles are also paralyzed. And the second one, we have brainstem herniation or coning. The cranium is a closed cavity. In cases of the raised intracranial pressure, the brainstem can herniate through the foramen magnum, which compresses the vital respiratory and circulatory centers of the medulla. Unknown Chiari malformation. This is a congenital defect involving a downward displacement of the cerebellar tonsils through the foramen magnum. It can cause hydrocephalus due to the obstruction of CSF flow. If you have any doubts, please comment, we will clarify it. Thank you. Have a nice day.